Doing a couple of different sessions here with some examples of things that we're seeing in the field now that we're in a completely different economy. We're kind of making strides with a lot of our practitioners to help them move forward. This is, in the medical business today, we have to think completely different. It's a new world. A lot of the medical practices that we are working with have got to think differently. And I'm going to go through 3 examples where we found some great success with pivoting business models where we're using a combination of marketing and teleconsulting or telemedicine or telehealth as a part of the strategy for an overall practice marketing plan for today's environment. Today's the very first week of April, and we are already seeing some great movement for the practices that we've spoken with and pivoted with. And let's get into 3 examples today. So the first one I'm going to talk about is a spine doctor who he's a private practice in Dallas, Texas. And he's had a pretty consistent business up until obviously a couple of weeks ago. We had to pivot quickly, set up his program so we could take some inbound telemedicine calls. And obviously, spine doctors have got a different, I guess you'd say, methodology on how they go to work with a client. It's a lot of hands-on. But in this case, in the general course of business, a lot of the necessity for surgeries can be delayed if they're not super impactful. But still, the initial consultation has become now a thing where it's being done via video, and a lot of discussion over pain and so forth. So what we're really seeing is that initial consultation coming in as a initial sort of pain assessment. And we're seeing this pain assessment being the standard now for putting together a plan when a patient has got certain indications of concerns. There's a lot of initial pain assessment through different types of questions and asking the right level of pain in each area and so forth. So these pain assessment strategies have done very well for him. And what's ending up happening is that they're figuring out whether or not they truly need an x-ray, because obviously a lot of people don't want to go out and travel right now. But if they do need an x-ray, they can get through that statement, which is great that, this is the time to get the x-ray, or it can wait. And that puts some ease to the patient's mind. Another thing is that since they're a private practice and they're not connected to the hospital, they have a little bit of an advantage because obviously the stuff that's coming from the hospitals are, let's just say, being sort of shuttled right now. Obviously, anything related to the hospital is going to be all related to the topic at hand. But I think the concept is that since he has a private practice and he can go to surgical centers, he has the option if there's an acute issue. And that's where it became sort of relevant for everyone who's in this space to think about the fact that there are, alternatives other than obviously doing procedures in the hospital. There are surgical centers that this totally makes sense if there's an acute episode. So this is something that's really interesting as well, is that the patients are calmed down now that they have a different attitude towards the strategy of the patient flow, which is that they're not necessarily going right to a diagnostic. And what's important about that is that they're actually going into a stage where they're becoming much more aware of their availability to potentially not have to be placed into a situation where they feel uncomfortable. And surgical situations can get delayed. And delaying at least gets the customer or the patient to become relevant to the market. So he's actually becoming confident with a doctor. So these discussions are critically important, especially at a time when people are at a point of unrest. So let's go through the second example. I want to talk about a med spa that we have up in Toronto. You'd think that just because the industry itself has been shut down completely, that they would decide to not do any work and shut their facilities. But this facility happened to have decided to stay open for virtual consultations, and they collected over 13 leads this weekend alone on just cool sculpting and other similar non-invasive procedures. One of the things that they were trying to do was determine whether or not clients, obviously it's the springtime, so we have a lot of clients who are concerned about their weight, And a lot of the very popular items like Brazilian butt lift and cool sculpting and other body shaping environments are becoming really hot topics because, as we know, there will be at some point a release back to some of the medical practices being able to reopen. Obviously, with some social distancing, it would make sense. So we're also looking at trying to help them prepare for future potential episodes. So with 13 new leads coming in over the weekend alone, the client's very happy that they're actually getting involved in conversations that have been productive. And these treatments that would normally need normal game plans would go to other environments if they weren't open. So we're actually looking at different strategies that are created for different frameworks for different physicians. And we know that these environments also include potentially getting customers discounts. So discounts are things that have been very helpful for a lot of the clients that we've been able to engage with who stay on, which is they can offer additional strategies for customers to make great savings with typical plans that would be more expensive. Now, in this case, what this particular doctor did was provide a double discount. That's right, a double discount for people who are willing to prepay for 2 months worth of service. So they're actually getting leads to come through, customers to prepay for services, although it's at a discount, but it's still customers coming through where other med spas are closed and shut down. They're taking new leads in and dozens of leads coming in to work with them. Because remember, people are still there. People are still active. So we want to make sure that we try and think through the real strategies here, which is to not bury our head in the sand and try and basically put our head under a blanket and say, oh, it's all over. The goal is to try and put strategy around the best way to get your practice thinking about moving forward in this economy. Now, the next one I want to talk about, which is our last episode of, or our last example, is a podiatrist here in New Jersey. You know, there are certain practices within the state that are allowed to stay open. This happens to be one of them that is considered an essential service. However, it's very difficult for this particular practice to be successful because of the issues around the concerns of its model. And its model is that it's trying to bring people in for intensive foot care. Now, in this particular case, we're starting to see the intensive or immediate checkups become something that can be done over a phone or over a tablet or a laptop. And that's what's happening to this particular practice, is that they're getting the first initial set of consultations being brought in by the doctors actually doing the consultations on a platform. We are using Doxy in this case, but you can use multiple platforms like Skype and Zoom. But the great thing is that they're actually getting new leads to come in for people who are in pain, and they're finding that they're having some success with taking those break fixes. So there are people who are out jogging and being very exercise-like now, and there's a lot of new people entering the exercise field that they haven't done before, and they're finding a lot of people are running into certain cases: knees, legs, ankles, even the traditional sort of, I could say, foot issues that are always common are becoming even more susceptible because there isn't anyone to go to. So there's also another factor of determining follow-ups and areas of concern. So there are areas of concern such as things that have happened in the past that are maybe coming back, so that you don't necessarily have to set up an appointment. You just have to be watchful. And a lot of advice has been given on these initial consultations instead of going directly through to get an x-ray or something like that where there's absolutely a necessary acute issue. But in this case, there's been a great deal of advice being handed off and creating a great level of trust with that patient. And that patient will eventually down the line become a long-term part of that practice. They may be still open and taking patients with, again, those acute cases, which is great, but there are still a lot of people who are going to be tertiary that need help. One of the greatest aspects to think about, and this is what they brought up specifically, is they're trying to prevent people from Googling themselves into either misdirected appropriate care for some sort of illness or injury, or going to actually a competitor by accident because they're looking for something and it ends up on a competitor's website and then they call that competitor. So the great thing is they're actually doing a great service for the community, giving great advice, getting new patients, and saving themselves from losing patients to competitors. So these are all the things that are happening out in the field. These are 3 great examples. We hope we can help you as well as you go through your journey through this new economy that we have. And certainly we're here to help you in assisting yourself in getting to a better position with your practice.